Hi, my name is Dave Hoy. I'm a physical therapist at Phoenix Rehabilitation. And today we're going to talk about a common problem that we see in our clinics, and that's low back pain. So what we want to do with every low back pain patient is we want to find a position or activity that makes their symptoms better. So depending on how compressed the nerve root is in someone's back, their symptoms will either be low back pain or they'll have symptoms that will radiate into the buttock or down the leg. We always want to see our symptoms centralized back to the source of the problem. So if someone has foot or ankle pain, we want to see the foot and ankle get better, then the knee, then the thigh, then the buttock, and centralize into the low back. So with every back patient, that spine either wants to be flexed or extended. So when that patient flexes or extends the spine, it will, quote, centralize that symptom. Centralization is also important because we know if someone's symptoms centralize during the initial evaluation, their success rate is better than 90%. So with Julie here today, we're going to go through some of the possible positions and activities that we may use to determine centralization with the patient. So the first one would be flexion, and we do that in a lying position. And what she's going to do is she's going to flex her knees up like that. So Julie, I'm going to ask you to do 10 of those for me. And what she's doing with that movement is this. She's opening the back side of the spine up. She's opening these nerve roots in here. So we'd know that's the right thing for her if it was centralizing her leg pain or making her low back pain smaller. If it was, that's what she would do at home. Okay? Okay, so the next thing we're going to look at is we're going to look at the converse of that, the opposite, which would be lumbar extension, which would be bringing the back side of her spine together, which would be most likely indicative of someone with a facet joint issue or a herniated disc. So I'm going to ask Julie to roll on her stomach. And often the most simple thing we'll do, and it seems benign and it won't be beneficial, is just lie prone, just lying on your stomach. But you can see with Julie here, as soon as she lies on her stomach, she begins to put some extension or some arch into her low back. So we'd simply test that for 5 to 10 minutes, and if that was beneficial, if that centralized her leg symptoms back up to the source, that would be her home program. Another modification to that would be prone on elbows. Just see Julie comes up now, and she's in a static position. It's a hold position, but you'll see the amount of extension here in her spine, the amount of lumbar curve. And again, we'd hold the position for 5 to 10 minutes, and if it's beneficial, that would be her home program. Something else we could look at would be a prone press up. Julie's going to press up, and you'll see that it not only gets us into an end range or an extreme amount of extension, but it also gets into an extreme amount of extension. It's dynamic. Believe it or not, there's some problems that even though the angulation is the same between prone on elbows and a prone press up, it's the dynamic part that makes it beneficial to the patient's problem. And the last possible solution we'd look at would be what we call lateral shift or a side glide. So I'm going to ask Julie to stand up. You're going to face that way. So with the side glide, we always test it with the therapist applying the side glide first. So it's just simply this, with the hips being shifted to the side. Okay? You would test left and right, and usually a patient that will benefit from a lateral shift or a side glide is someone that has symptoms only down one leg. But again, at the time of your evaluation, the physical therapist will be the one that would determine that. So again, remember, centralization tells us that if a symptom is to the foot or to the leg, we always want to see the leg symptom get better first, the low back pain get better last. So if you suffer from back pain, or you have any problems, or friends that do suffer from issues like this, you want to give us a call. We'll bring you an evaluation, and this will be the first part of your home program. Thank you.